Hi, I'm Robert Sievers, and I'm going to give a speech on heroin today. Hi, I'm Robert Sievers. Today I'm going to give a speech on heroin today. So, picture this. We're sitting at the firehouse, doing training, receive a 911 call for a female that is unresponsive. On our arrival, we see a 19-year-old female that is unresponsive with minimal breathing. We start going through differential diagnoses in our mind of, is this a drug overdose? Is this a brain injury, or is it a cardiac issue, is what we think. We also see a bystander off to the side. We don't know who he is. We don't get any medical history or anything about what this female is going on. Heroin has become a epidemic out there lately. It's important that we make people aware of a few things out there. The importance is to educate the population of the history of heroin, and also uncover the threat of the increase of the addictions out there, and also uncover the importance of the treatment. Heroin also goes back as far as 3000 to 3500 BC with the Menestonians and the serpents culture. It didn't become abused until close to the 1800s is when it became abused. What they do for morphine is they synthesize it from, they extract the seeds from the opium plants. That's how they synthesize the morphine. Addiction is addictive. You do it once and you're hooked. If you look at, for example, if you look at the people that take place in cigarette smoke, the population that does that. On the other hand, heroin is addiction too, because once you do it once, you're hooked onto it, and it's also it takes place in very many different poverty levels, to the middle class, to the high class. People go about going out of their way to get in any way they possibly can. That's why it's so high. That's why prostitution is so high in the heroin communities. Methods of using heroin: you have intravenously, which is the fastest. It takes 3 to 5 minutes for that to take effect in your bloodstream. When they mix morphine with cocaine and shoot it intravenously, it's called eyeballing or speedballing. When they sniff it or snort it, what they do is they liquefy the morphine or the heroin, they liquefy it, and then you put it in spray bottles. That's known as sandbagging, is what they call it. And then when they mix, like they'll do a line of heroin and they'll do a line of cocaine, they call that crisscrossing also, and smoking it also too. You have a handout there also. I have given you 2 handouts for this. We're going to use, the first handout is going to be this one here, what we're going to use. So the long-term effects, the effects it has on the body is going to be a short-term effects. They get a quick euphoria, their bodies feel really heavy. They also have a flushed, warm skin. Long-term effects would be like hepatitis C, liver disease, pulmonary complications, which infection. They also get infections on their skin, like abscesses is what they do for that. Also called skin popping is what they do when they get that. Overdoses, the probability of death is 2 times by death, and usually when it does occur, it's by a heart attack most of the time. They also mix heroin with different things. Sugar, starch, fentanyl is the newest one out there too, and they also mix it with other poisons also. Withdrawing occurs 42 to 72 hours, and when they become withdrawn, when they crave the drug really, really bad. They also have nausea, vomiting, restlessness of the legs, muscle and bone pain also. People right now are going to local hospitals and getting bogus complaints also about trying to get prescription drugs also. And what they do with that is, when they give us a bogus complaint, prescription drugs are readily available versus heroin to get. So when they do that, they take the population takes the drugs that they get from the pharmacy, and they go and they sell it for the drug of their choice. Reason for abuse, it's available anywhere. According to the Substance Abuse and Mental Health Administration, there's been an increase too, which is going to be on this handout also. The soaring of heroin, especially in the rural areas, what they're doing is they're going away from the prescription drugs, and it's because it's tougher to get the heroin. The number of people just in 1 year using heroin has jumped 53.2%. That was just as you can see on the chart there also. Nearly half the young people admit that they've used prescription drugs prior to using heroin, and reports say it's cheaper than prescription drugs also. According to a study available through USA Today, the Addicted said that once you're addicted to opium, you'll do whatever it takes to get what you can, and you'll go out of your way to get what it takes, especially when it's cheaper. It's only $80 a gram. We also need to stop the cycle of what's going on. There's now what they try to do to stop the cycle of getting people heroin is local pharmacies have chains that when a person comes in with a prescription drug, if they come in several times over and over and over again, they'll flag them and they'll call their doctor and let them know that they have been in here several times. Also, the hospitals have also done that also, where they see how many times you've been in. If you come in repeatedly for prescription narcotics, they'll red flag that also. What we need to do is we need to, continue to try to stop the heroin epidemic, as you can see on our charts also. We also need to increase the education of the population, the high risk of addiction, and the health promotion in schools also. And we need to attempt to stop the cycle of the heroin epidemic by giving the people resources and treatment centers that we can. Thank you. Any questions?
The fentanyl, come back. No. You didn't have a question.